to the doctor, I had to have another, did I have a biopsy that time? No. Yes, I did. I think I went ahead and had my pap smear or my biopsy then. I'm so sorry, guys, but it's just been a minute. So I did that, and within a couple of days, they were calling back and let me know that there was some minor progress. The cells had not increased, but they didn't go away. So they were still like, they weren't as bad as what they thought in January, which is good. But my doctor still wanted to go ahead and go through with the surgery. So I went on July 26th for that appointment. They called me. I had to schedule my surgery to have the LEAP procedure done in August. August 7th is when I had the surgery. And I talk with my hands, I'm sorry. So did that, and I had to have like some lab work done before the surgery. I was extremely scared, and I think in my first video I talked about how I didn't want to have the surgery because I don't know, I am going to be 30 June of this year, and the only thing I want in my life is to have kids. Like, that's it. So the thought of not being able to have kids, like, that scared me. And people who have the surgery, they get pregnant, they have kids, successful pregnancies. But it was just like, I didn't want the risk, because there is a risk. But even though my doctor was saying, nobody has, not many people have a problem with it, whatever. And even when I released my first video, a lot of people reached out to me saying that they were going through the same situation. They had kids and all this stuff, and not to be worried about it. I still had that fear. But I had to have the surgery. So I went in at like 7 o'clock that morning, and the surgery was supposed to last, I think, like 15 to 30 minutes. And my mom said I was back there for an hour. So when the doctor got in there, basically she seen the way that she wanted to do the procedure, like the LEAP procedure to begin with, it wasn't going to clear all of the cells. So she had to go in and do like a different procedure to where she could have clear margins and get all of the cells, and to make sure that I wouldn't have to come back and get multiple surgeries to remove the ones that were left behind, and which I was thankful for that. Yeah, this surgery itself, of course, I was put to sleep. I didn't feel anything. It was fine. I went back into the recovery room, and I couldn't leave until I used the bathroom, and I was pretty ready to leave. So they gave me ibuprofen. So I did have over-the-counter medicine then, because they asked me if I wanted to take 800 milligrams of ibuprofen, and I told them no. And my mom, my dad, and sister, they know my pain tolerance, and they were like, no, girl, you need to take it now before you start hurting. And the only thing that was hurting at that time was like my right hip. I guess the way they had me positioned in surgery, it was very uncomfortable. So I just kept like pushing my leg out. Like, that was the only thing that was uncomfortable. But I took the medicine, and of course, because I hadn't ate, they gave me like some little saltine crackers and some ginger ale maybe, or Sprite. And that was it. I took it. I used the bathroom, got dressed, was out of there. We didn't make it far, because probably, I don't even think it was 5 minutes, I got real nauseous in the car. Thank God for my mama, because she let me throw up in her car. I mean, I didn't throw up all the way in her car, but she pulled over. I got off the car, threw up on the side of the road, and then she like got like, all she had was like a little like gift bag, and she put like some paper towels in it, and I got back in the car and was still really dizzy, so people were having to help me like walk and use the bathroom, all that stuff. I couldn't do any of it by myself. So she had to help me get out of the car, help me throw up on the side of the road, get back in. I got this little bag. We start driving down the road. I start throwing up again. It's very like thin. So yeah, I threw up in my mama's car. Get home, got to my sister's house. Really, the pain kicked in. Like, if you know what period cramps are, it's 10 times worse. That's what it felt like. It was 10 times worse. I just wanted to like go to sleep. I just wanted to lay down on my stomach. And yeah, nothing was helping. I had already taken the medication. I had already threw up the medication, I guess. Didn't have my prescription yet. Didn't want people talking to me. My mom kept asking me how I was doing. I didn't want to answer questions. Eventually she made me like some peppermint tea, I think. Oh, I put some peppermint essential oils because I love essential oils. I put that on my wrist and the back of my neck and my temples. And then my mom made me some tea. And I don't know if it was peppermint. I don't know what kind of tea she made me. But I drank the tea and it's like my body relaxed and I was able to doze off. Every now and then I'd wake up, doze off, wake up. But whenever I need to use the bathroom, my sister had to take me to the bathroom. Love her too, because I could not stand up to use the bathroom myself. Yeah. So eventually I ate and stuff, and the next day I was fine. There was no pain. I didn't take any of, really didn't take any of the prescription, the 800 milligram of ibuprofen, and I had some hydrocodones too, but I didn't get those filled. No, not doing that. So I may have taken some more ibuprofen the day of the surgery, but I didn't anymore after that. And I was back at work the next day. I worked from home, and then Friday I like went in for like a meeting at work. So that was how my surgery went. It was fine. So after surgery, my doctor, I went back in for a 2-week checkup. And really that was just to see how everything was going. Like, they didn't go inside and check. And I had to have 2 sutures put in from the surgery. So I was supposed to be prescribed an antibiotic to make sure that no infection set up. And I was still like, the bleeding from the surgery was supposed to stop. And I'm sorry if this is TMI, if a guy's watching my video, but this is life. The bleeding from the surgery was supposed to stop after a couple of days. And within like 2 weeks, I was still having some bleeding every now and then. Like, I had to wear like pads, and homegirl was like almost through a whole pack of pads, and it wasn't supposed to be like that. So they had forgot to prescribe me my antibiotic. So I got my antibiotic at that 2-week appointment and took it fine. It stopped. Everything was good. I had to schedule a 6-month checkup to make sure all the cells were gone February 20th of 2020. So I went back for my checkup February 20th, 2020. That's a lot to say. But I went back and had a pap smear done. I did think that I had like an infection at the time, like a yeast infection. Again, if this is TMI for a man, I'm sorry. But women know. They feel me. And I told my doctor that. I let her know. So she did the pap smear. And then a few days later prescribed me some medication for the infection. Well, I left and had a prescription for the infection. And then she gave me some more like a few days later. But they did say that my pap smear came back abnormal. But like, I don't know what the word is. I wasn't familiar with the word she used. And I asked her about it. It sounded like effluent or something like that. And I'm probably saying it wrong. So if you're a nurse and you know what you're talking about, like, just let me know what the word is, because I can't remember. But I asked her what that meant, and she said very, very low abnormal pap smear. And she said that she thought that it was probably from the infection. And instead of me coming back for another 6-month checkup, she was going to check with the doctor and see if, because this was the nurse I was talking to, she was going to see if I could come back in a year. So I was happy. Very, 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 very happy. Like, thank God, praise God, I don't have to go back for a year. But that changed a few days later. My doctor looked over my results, and she didn't want to take any risk, so she wanted me to come back in for a biopsy. And I just felt defeated, because that's more cutting and tampering with my cervix. And again, I just don't feel like having things tampered with that could essentially hurt me from having kids maybe in the future. I don't know. But I did it because, like my mom and my sister said, you need to be, it's better to be safe than sorry. And so that's what I was going to do. So I went in on March 11th, 2020 to have my biopsy done. Very nervous. I had been at work that day. I left work, got me something to eat, chicken salad chick, and then I went over to my appointment. So I got in the little procedure room, and I'm chilling, nervous. I'm praying, like, just let everything come back normal, whatever. So the doctor comes in, the nurse comes in, it's time to start the procedure. So I'm sitting on the exam table, they lift it up, my bottom half has to be even with the doctor's face, because she needs to see in there while she's sitting in the chair. So that's how high, I was pretty much 4 feet off the ground. I learned this later on. So she had to take, she puts vinegar in there. If you've never had a biopsy done before, she put vinegar in there to see if anything pops up, any abnormal cells, anything like that will show with that vinegar. She didn't say nothing. And I'm pretty sure this is right. If I'm wrong, whoever knows the right, tell me. So then she takes a sample of my cervix to be tested. So she did the first one, and she pulls it, and she tells me to cough. I coughed when she pulled it. I'm like, okay, it wasn't bad, but it's ooh, it's a little too much. So she puts the sample in there. She's like, oh, I don't think I got enough. Let me take another sample. So she goes in. She latches on. I feel it. She tells me to cough. A little cough. I didn't really cough big. She pulls, and the sample, which is skin, it's like tissue. It's not skin, but it's tissue. It doesn't come. So she tugs again, and I feel it, and it's like, ooh, okay. That one hurt a little bit more. So she finishes it. She does this little brush and sweeps, get some more samples of my uterus and stuff like that. So, yeah, she did that, finishes up, she raises the back of the table up. I'm sitting up. She's asking me questions, and I feel nauseous, dizzy. I normally feel nauseous at least once a week. Like I said earlier, I have some stomach issues. I probably need to get checked out. I just have acid reflux. I know that, but I need to take my probiotics daily. I do. So I was like, I'm nauseous, dizzy. Okay. I didn't say anything. I'm still listening to her talk. And next thing I know, my doctor and the nurse are over me saying my name. And I thought that I had had a dream. I did. I don't remember what the dream was, but I had fainted and fell off of the 4-foot high exam table. So I'm laying between the counter and the exam table on the floor, my doctor and my nurse looking over me, asking me if I'm okay. So they tell me I fainted. My doctor's asking me if I have a history of seizures. I don't have a history of seizures. I'm like, I felt nauseous and I felt dizzy, but I didn't think anything of it. So they like give me a pillow for my neck, lift my feet up, and they're asking me if anything in my body is hurting. I'm like, no, it's not really hurting. I'm still laying on the ground at this point. And then I was like, oh, my tongue kind of hurts. And they're like, yeah, you bit your tongue when you fell. So that was hurting. And then my hands, they kind of were like stiffening up. Like, it's kind of weird. Like, I can't do it when they're not doing it. But I've done it before when I had my panic attack. My hands stiffened up before the full-fledged panic attack came. So my hands were tingling and they started stiffening up. And I told them, this is what I did when I had a panic attack. But I'm not feeling anxious, but this is what happened. So they're trying to help me breathe and stuff. Eventually they like loosened up and I didn't have a panic attack. I didn't do any of that. And they started to help me up and I could feel like the side of my face hurt. And I was like, okay, yeah, the side of my face hurts. And the nurse told me that the side of my face was swollen because I kind of was like on this side, but my right leg was crossed over my left leg and in like this tube that was on the side. It's very strange. When I started to get up, my right hip started hurting, like right thigh was hurting extremely bad. And I was like, oh, I'm going to have a bruise right here. Oh, also keep in mind that while I've passed out and I'm laying on the floor, I have no pants on because they had just finished the procedure. And only this would happen to me. Like, literally, only this would probably happen to me. So I get my pants on. I'm starting to get dizzy and nauseous again. So I'll tell them, like, hey, I'm getting dizzy and nauseous again. I've had to call my mama, tell her to come pick me up. They moved me to another room, want me to lie down. It's just like, it just got worse. Like, I thought I was going to pass out again. I'm dizzy. I'm nauseous. I don't know what to do. The pain in my stomach is hurting. It's hurting really, really bad. At that point, it's like I felt like I lost all control over my bowels. Like, I needed to go to the bathroom. Really, really bad. So I asked them, could I go to the bathroom? They helped me get to the bathroom. I used the bathroom. And then I came out, laid down. I told them to lay it down to where I could lay on my stomach. So I laid on my stomach and I still was nauseous and dizzy. They came to check on me and ask me. And my mama hadn't got there yet. And I was still nauseous and dizzy. So the doctor eventually comes in and says, we're just going to send you down to the ER because we don't feel comfortable sending you home and you may get there and have a concussion. And yeah, so we're going to send you to the ER. Just tell your mom to meet you down there. So they sent me down there. I got checked out, had a CAT scan done. Or CAT scan? No, CT scan. I had a CT scan done of my face and my head to make sure I didn't break any facial bones because this side of the face was swollen. And of course, I hit the back of my head. And all those results came back and it was negative for, I didn't have any broken facial bones and I didn't have a concussion, which the nurse said that I could probably still have like a mild concussion, but yeah, not one to where there was any like trauma to my brain. So they sent me home that same night. So I've just had like teeth marks on my tongue, bruise on my thigh, pain the next day, like very stiff and sore. That was it from that. it took a while to get results back because that was March 11th, I think I said. Yeah, March 11th. And I was supposed to call back the next week to get my results. When I called, all of this COVID-19 stuff started. And so I didn't hear back from my doctor until the next Sunday. Yeah, it was like almost 2 weeks later. And she called back and said that she had just taken a while to let me know my results because she wanted to get a second opinion on my case. So my biopsy test results came back negative. So there was no abnormal cells. But because my pap smear came back abnormal and my biopsy didn't, she wanted to just double check with another doctor to make sure, that was a common thing to happen. And then also when she did the second little thing of the biopsy, she got a sample from my uterus and it came back negative, and the rest of my samples came back negative, but the endocervix, which is like the canal, I guess, there wasn't like a sample that came back either way. So we're just waiting. I was supposed to hear back from her at this point. I think it was 2 weeks ago. I was supposed to hear from her last week. Yeah, I was supposed to hear from her last week, and I haven't, which it's understandable because we have a lot going on right now with quarantine stuff. So that's fine. I'm just happy that the results came back normal from my biopsy. So at this point, I'm not very concerned, but I'm still going to be on top of things. I need to get back on like eating healthier and eating healthier and stuff. But really, I feel good. I've had no issues. I don't want to have any more surgeries. That's the other thing. If they want me to come back in to do another biopsy to test the endocervix that they didn't get a sample for, at this point, I really don't want to get another biopsy done. But if I have to, I will. And if it comes back positive, then they want me to do another surgery. And that's what I don't want to do at all. Like, I don't want to do another surgery ever. But I would just appreciate if everybody would continue praying for me. Just keep me in your prayers, your thoughts. Send me good vibes, good energy. If you have any questions, and if I didn't touch on something that you were wanting to know about, just send me a message, and I'm very open about things that I go through. Like I try to be like, I don't even know what the word is. I try to be very vulnerable, and especially with things like this that I feel like may help someone else, because before this, I hadn't had anyone talk about cervical dysplasia with me. My mom had mentioned having it whenever she was 26. Right after having me, she had to have a complete hysterectomy because of endometriosis, cervical dysplasia. So that was the only thing that I had, like the only time I'd ever heard of it, and I really didn't know what it was. So I just feel like bringing awareness to it and just letting women know going to get your annual checkup is important. I had people tell me that they hadn't had a checkup in years, and I try to at least stay up on that. I know the longest time had been the 2 years, or maybe a little bit more, before I had went back and found out that I had the cervical dysplasia. But this is very, very important. You don't want it to progress until it's cervical cancer and it's too late. And so that's my only reason in being as open as I can be with you guys and letting you know my situation. some people are embarrassed by it. At first, I didn't want anybody to know, but God laid it on my heart that it was important to share with other people. And so that's just my story. That's really it. If I get any more updates or anything, then I will let you guys know. Hopefully it won't take a long time. If there's any more videos, like, I really don't think I have anything else in my life going on, but if there's any more videos that you guys want to see from me or want me to discuss, let me know. I'm pretty active on Instagram, that you could, DM me on there or something like that. But thank you for watching this video, and thank you for being on this journey with me. I appreciate you guys.